All right, class. Good morning, good afternoon, good evening. This is Dr. Kaz, and this is the third installment to Chapter 5 on tissues here. I'm going to be wrapping up this chapter here for you today. And we were finishing up the four different types of tissue in the body. Just to review, we have epithelial tissue, connective tissue, muscle tissue, and today, or in this video, I will be finishing up nervous tissue. Okay, so let's jump into and talk about what the purpose of nervous tissue is. We're going to go into much more detail later on in the course in chapter 12. But nervous tissue, you really want to think that nervous tissue is the movement of information. Basically, it's one of the control centers for the body, the endocrine system being the other control center. But it basically is going to govern pretty much all of the functions of the body, and what it doesn't, the endocrine system will help to kind of take over. So we are going to find this tissue located in both our central nervous system, which is made up of the brain and the spinal cord, and then our peripheral nervous system, which is made up of our nerves here. Okay, so there's a couple types of cells that make up this tissue. The first one, the rock star cell, is going to be the neuron. Okay, and its function is going to be basically to receive information or input, then transmit that input of that information, and then process that information, and then decide on what the action is going to be. So basically, neurons receive, transmit, and process these nerve impulses throughout the body. And of course, just like with any rock star or superstar, there's an entourage or support system, all right? And so the support cells for neurons are going to be the glial cells. And these cells outnumber the neurons, okay? They actually make up the majority of the nervous tissue, all right? But one thing you do need to understand is they have no functionality when it comes to, all right, the transmission of nerve signals, okay? They do not transmit nerve impulses, but they do pretty much everything else. They help to protect the neurons, all right, from damage. And if they do get damaged, then these cells help to repair the neurons. They nourish the neurons, so they're kind of like the gopher. They will help to bring nourishment to the neurons, and in some situations, they will help to support the neurons throughout the body, all right, to sustain them. And it's really interesting because if there's a considerable amount of damage to a neuron or space in some of the nervous tissue, if unfortunately, God forbid, that if the neurons do die and degenerate, then the glial cells will kind of fill in, so they can almost kind of form like a scar-like tissue in the absence of the neurons there. So when we talk about a neuron, and you'll have to forgive my poor drawing skills, but here's the cell body, and then it has one big process that comes off, and it terminates at the far end here. We have a couple structures at the far end. We'll go through these, all right? And on the cell body, you have several smaller processes that come off, okay, the cell body. So the cell body is where we're going to find our nucleus and the majority of the organelles inside the neuron, all right? And as you can tell here, let me switch over. Okay, these little poorly drawn lines here, these are some of the smaller cell processes. Those are called dendrites. And then we have this big, long cell process, and that is called the axon, all right? So think of the dendrites as basically these extensions off the cell body, and their job is going to receive incoming information, and at the same time they can also transmit information from one neuron to another neuron, or from one neuron onto some tissue, okay? But the big, long, outstanding process there, that's the axon. Think of that like a telephone cable. Well, we don't have those as much anymore because of cell phones, all right, but they're going to transmit, all right, a signal from the cell body down to the terminal end of the neuron here, okay? And that those ends there are called the synaptic terminals, or end knobs, or bulbs, all right, but we'll go into much more detail about that when we get into chapter 12. All right, so you can see here on our slide, we have nervous tissue here, and the neuron is pretty. The appearance of the neuron is pretty significant, and it's what's the word I want to use? Obvious. All right, it has a very unique shape to it. So the cell body is right here. Here's the nucleus, but it has all these extensions coming off, these smaller extensions, and then you have one big extension coming off here. All right, and that is the axon. Okay, so you can see on this other neuron, here's the nucleus here. All right, and then you have all these extensions coming off here and here and here. All right, we can't see it's dendrite, it's up over here. And these little dark dots here, those are the glial cells. Okay, you can see those all scattered throughout. So granted, they're not as big or as long as a neuron, all right, but there are scattered throughout, and they're much more numerous in number than the neurons there. So they make up a majority or considerable amount of the tissue, all right, when we're dealing with nervous tissue. All right, so we just finished tissues, and when we go in our levels of organization, all right, again, we started off with the atoms and the molecules, and then we moved up to the macromolecules like the lipids and the carbohydrates and the proteins and whatnot. And then we moved up to organelles, cell organelles, little operating structures inside of the cell, and then graduated up to the cell itself. And now we've taken a bunch of cells, all right, similar cells, and we've thrown them together, and they perform a common function. Now we've had tissues. Well, now we're going to take a bunch of tissues, okay, at least two or more tissues, and we're going to throw them together. All right, now they don't have to have the same function. They could be have several different functions. All right, and we're going to place them together. All right, and we are going to now have an organ. Okay, so like this slide here says, all right, you'll have several different structures, all right, that work in concert. So think of all the organs in your body, like the liver. The liver has several different functions. It makes bile, it makes several of the proteins, all right. It helps to filter out drugs, all right, alcohol, that sort of thing. So it has lots of different functions, but it all has to work together, all right. So keep in mind, they're not simple functions, but they'll be more along the complex type, all right. And the example that your book likes to use, and I like it too, skin falls into this category also, all right. But organs can contain all four tissue types. They don't have to contain all of them, all right. But your stomach is a great example of that, all right, because all right, as we break it down here when we're dealing with the stomach, all right, the first type of tissue is the epithelial tissue, okay, and the epithelial tissue here, all right, will line the inside of your stomach, and a lot of this epithelium will secrete some of the digestive enzymes, amongst other things like the hydrochloric acid and whatnot, pepsinogen. We'll talk more about that in 211, but it will create these digestive chemicals and enzymes that help to break down the nutrients that you ingested. All right, now deep to the epithelium, as you know, because epithelium sits on top of connective tissue. All right, so right underneath the epithelial tissue, all right, in our stomach we have areolar connective tissue. That's that loose connective tissue, and then deeper to that we'll have some of that dense irregular connective tissue that sits underneath, because your stomach, again, because of the digestive properties that it has, needs to absorb those nutrients. And where do we absorb them into? We absorb them into blood vessels, okay? And to operate this machinery, we have our nervous tissue, okay? The nervous tissue helps to operate all this machinery involved in the stomach, because when we're secreting those digestive enzymes, the glands will play a role in that secretion, and the nerves will stimulate the glands to do so. All right, when we're dealing with the third type of tissue in the stomach, all right, that's going to be the smooth muscle. All right, and it's laid down at various, there's 3 layers of it, but it's laid down in different planes or orientations to one another. So it helps with the contraction and the relaxation of the stomach wall, so we can mix things up like a cement mixer does, those big trucks that you see. All right, mixing up the cement, well, your stomach is going to mix up the contents, mix up the nutrients with those digestive chemicals. All right, and it helps to move it out. Well, what helps to cause those smooth muscles to contract and relax, again, is going to be that nerve tissue there. All right, that's going to help to regulate that. Okay, so this is just a great example, and I'll show you a picture here of all four, all right, types of tissue in the body that are present in this one organ here. Okay, so we can see here on the inner layer of your stomach, all right, we have epithelial tissue. All right, then just below that, we have our connective tissue. Here's our loose connective tissue. All right, along with our dense irregular connective tissue, here we're going to have our blood vessels. As we digest and start to absorb the some of the contents that we've ingested, it'll move here into the blood vessels. And then we have our 3 layers of smooth muscle that'll contract and relax in certain alternating, I guess, rhythms there to mix everything up. And then scattered throughout, we'll have our nervous system, our nerve tissue, all right, that helps to control all that. So that's just one of the examples, all right, when we're dealing with the different tissue types that are going to be involved in the presence of organs, okay? So you've heard me talk about body membranes. We started off talking about, all right, the serous membranes when we were dealing with body cavities and the lining of those body cavities, all right? But we talk about body membranes in this chapter too, all right, because these body membranes are formed by one of our tissue types, which is epithelial tissue, okay? And then we'll also deal with underneath that epithelial tissue. Keep that in mind. That's a common type of relationship there. You'll have epithelial tissue, and it sits on top of connective tissue. All right. So we'll see, all right, that these body membranes, all right, will cover not only body cavities like we saw with the serous membranes, it'll also cover some of our organs, the viscera there, all right. And when we're dealing with the skin, that is also considered the cutaneous membrane. It'll line the exterior surface of our body, all right? And sometimes it'll line some of the areas inside, like our throat, our nasal cavities there, all right? So there's 4 types of body membranes. The mucous membranes, all right, and it serves several functions. Mucous membranes help to lubricate, and believe it or not, you have a significant presence of antibodies, the IgA antibody that sits in the mucous membrane that helps to deal, so it's a first line of defense when we're dealing with the immune system. And those are going to be found in various places, usually close to the entrances and exits of your body. All right, we already talked about the serous membranes. When we talk about chapter 6 about the skin, we'll talk about the cutaneous membrane. And then we get to chapter 9, we'll deal with the synovial membranes. And synovial membranes are going to be found within joints, the synovial joints, which are joints that have a capsule and fluid. So an example of a synovial joint is going to be your knuckle or your knee. Okay, there's fluid in there. So we'll talk more about that type of membrane when we get to those later chapters there. All right, this picture here just shows you all the different places, all right, that these membranes are located in your body. All right, you can see here the mucous membrane. We're showing how the mucous membrane is located here in your nasal cavity and in the back portion here of your pharynx there. Serous membranes, we talked about that, line some of the viscera and the body cavities there. Cutaneous membrane, where you're looking at it, when you're looking at the back of your hand, the back of your leg, top, it's all right, that's going to be your skin. Then the synovial membrane is going to be found within your synovial joints. We'll learn about where all those synovial joints are located throughout your body. All right, so mucous membrane here, all right, remember what I was saying, there's going to be several immune cells there, namely the antibodies, the IgA antibodies. So we're going to want to place this type of membrane close to the external environment openings there, all right? So your mouth, all right, your nose, all those areas there, and in some of the reproductive tracts, all right, the vagina there, okay? So we're going to have this type of membrane because of its job, all right, it plays a big role in protection through the immune function, all right, but also because of its secretory functions, because it's going to provide lubrication, especially if you're going to be swallowing food and whatnot. Right, we don't want to damage our epithelium, okay? And especially when you're breathing in, you'll talk a little bit more about it when we talk about the respiratory system. But when you're breathing in things into your nose, all right, depending on where you live, there's going to be pollutants that will be in the air. And so we want to trap a lot of those particles. And some of those particles, especially if it's an airborne pathogen of some sort, we want to trap it. And then we can kill it off before it gets into the internal environment of our bodies there. All right. So these membranes, all right, are going to be made up of epithelium with, again, here's that pattern again. All right, we have lining of the membrane is going to be the epithelium to the external surface there, and then underneath it we'll have connective tissue. All right. So within this type of membrane, here we see some of those goblet cells that we learned about, all right, when we were talking about some of our columnar epithelium. Okay, so and then we'll also see actual mucus glands, especially when we talk about in chapter 16, when we talk about the olfactory sense there, you have these specific glands that will produce mucus, all right, in the superior portion of your nasal cavity to trap what we call odorants, which are these particles that will be trapped in this mucus, so we can actually attach it to another protein to actually receive that sensation of smell. We'll talk more about that in detail later on. See how much you have to look forward to at later chapters. All right, serous membranes, I think we're pretty good on that. All right, keep in mind just a quick review on the serous membranes. They are going to line the body cavities, all right, and they will also line, all right, the viscera in some of those body cavities. Made up of simple squamous epithelium, we refer to that as mesothelium. Okay, and there's two layers to it. All right, you have a visceral and a parietal layer. The visceral layer will lay on top of the organs themselves, or the viscera. The parietal layer will usually line the internal surfaces of the body cavities. There is a space in between, which is called the serous cavity, and in that space is where we have our serous fluid. Okay, and again, its job is to reduce friction, so we don't damage things. Okay. All right, the next type of membrane is going to be the cutaneous membrane, also known as the integument or the skin. All right, it is going to be on the external surface of our body, made up of keratinized, dead cells, but keratinized, stratified, squamous epithelium with connective tissue sitting underneath. Okay. And its main function is for protection and prevention of water loss, protects the organs underneath. One of the organs that sits underneath your skin, all right, are your skeletal muscles. Okay, amongst some of the other actual named organs that live inside the thoracic cavity, the abdominal cavity, and whatnot. Even your bones, all right, that's actually considered an organ. All right, and then the last body membrane is the synovial membrane. Okay, we will find this type of membrane in the joints. Okay, we have our areolar connective tissue that helps to make up part of this membrane, and on top of that is our simple squamous or simple squamous epithelium. All right, which is interesting here. Again, there's always exceptions to the rule. I know we've always talked about how underneath epithelium is the basement membrane, but in this situation, all right, synovial membranes, all right, the epithelium there does not have a basement membrane. Okay, so there's always exceptions to the rule, and I'll try to point those out to you as we move through the course. All right, but what's important about the synovial membrane is that it produces synovial fluid. All right, now there's many roles for synovial fluid, which we'll go into detail later on, but its big role is to reduce friction in the joint itself. Okay, acts as a shock absorber, also helps to distribute nutrients to the underlying cartilage, because we talked about hyaline cartilage, and hyaline cartilage will line what we call the articular ends of bones, and that's basically saying that those are the parts of the bones that will connect or touch with another bone to form a joint. All right, so you hear articulations, and basically articulations are joints. So of course we line those ends of those bones with hyaline cartilage to protect the bones. Okay, and then we wrap a capsule around it, and we have fluid inside of that capsule, all right, which is that synovial fluid. Okay. I'm going to talk about tissue development here. This is probably the only part of the uh, um, embryology that I will get into. I'm going to be honest with you, I wasn't a big fan of embryology when I first discussed it um, or learned it, and it's tough, but we're only going to talk about it just briefly here, okay? I don't expect you to be, because there's whole courses on this. We're just not going to, we don't have the time, and it's a lot of course content, so we're just going to give you kind of the quick overview of embryology, all right, or at least a small portion of it. Okay. So when we talk about how our tissues come about, all right, the tissue development here, all right, we got to start from way back in the beginning, okay, when the sperm fertilizes the egg, okay, and we start off, once that occurs, all right, then we get what's known as a zygote, all right, that's a diploid cell, all right, which means, all right, we have some genetic material from mom and we have genetic material from dad, okay, because the sperm and the oocyte, which is the egg, all right, are haploid cells, okay, we have 46 chromosomes, all right, but each of those, okay, each of those has 23 chromosomes. All right, so the sperm has 23 chromosomes, the oocyte has 23 chromosomes. So when fertilization occurs, we just add them together, and then we have 46. And that's what all of us as adults have, all right, kids have, same thing, all right? So once that occurs, we get a diploid cell, which we call a zygote. The zygote just has one job, and its job is to divide. And it keeps dividing and dividing and dividing. All right, and it gets to a certain point of division that we refer to as a blastocyst. Okay, again, it will continue to divide, and eventually it will form our embryo, and we call that an embryoblast. Okay, now there's a lot of things that occur. All right, now, but up until the third week of development, all right, through these divisions and this development of the tissue here, we eventually form out 3 layers of tissue, okay? And we call those the primary germ layers. This happens at week 3, okay? So the 3 germ layers, and you want to make sure that you know this, are ectoderm, mesoderm, and endoderm, okay? So later on, when you hear that this tissue or this organ developed from the ectoderm or is a mesoderm derivative, you'll understand what that is, okay? But basically what will happen is by the 3rd week, all right, what we look like is we look like a plate, all right, kind of like a flat dish almost, all right? And we have these 3 germ layers, okay? So once that occurs, now we're referred to as an embryo, hence embryology. All right, so that first germ layer, the ectoderm, okay, this will essentially be on the back and external or outside. So if you're looking at an actual embryo, you'll see the ectoderm. All right, this is what happens initially. So like on the outside of us, it would make sense then, all right, that the ectoderm, all right, would make up the epidermis, the outer layer of our skin. And then what also do we see that derives from the epidermis? Hair, nails, and our exocrine glands. Now we learned in the previous class that exocrine glands start off in the ectoderm, but then they'll invaginate themselves or push their way down into the dermis. All right, same thing with the hair. All right, that will push its way down because a lot of those hair follicles we see are found within the dermis and the subcutaneous layer at times. Okay, nails are that stratum corneum derivative, so that there's no change with that. Okay, so consider that the ectoderm is the outside, right? So we have a lot of our external structures that we see come from this layer here. Okay, so keep that in mind. All right, all right. The next tissue layer is the mesoderm. All right, obviously meso, middle, M middle. All right, this, it's easy to remember this. That's how I remember it. M mesoderm, M muscle. All right, this is where all of our muscle tissue comes from. All right, also the lining to our blood vessels, all right, and lymphatic vessels, all right, that endothelium, all right, is going to be found in the derives from the mesoderm and our serous membranes, all right. So those membranes that line the internal body cavities and the viscera internally, okay. Now, another way to remember mesoderm, mesenchyme, or if you want to pronounce it mesenchyme, just to make it a little bit easier for you to remember. All right, we discussed what mesenchyme is. Mesenchyme is that embryonic, all right, connective tissue, okay, that can kind of then it can either develop into connective tissue proper, connective tissue, or supporting connective tissue, and fluid connective tissue. So essentially, all right, mesoderm, all right, it will derive into mesenchyme, and so that means all of the connective tissue in your body comes from the mesoderm. So think of all those different tissues that we reviewed earlier, all right, bone, cartilage, okay, all of that comes from, all right, the mesenchyme, okay. A couple other things that we see from the mesenchyme, or not from the mesenchyme, from the mesoderm, all right, the dermis, the deeper layer of our skin, all right, the adrenal cortex, that's the outer portion of the adrenal glands, all right, heart, spleen, kidneys, ureters, and then our internal reproductive structures, okay. All right, and then finally, the last layer here is the endoderm, okay. So a couple things that you want to see. I mean, I could say all the rest of the stuff that's in your body. I'm just going to run through a few things here. All right. So our eardrum, all right, that cavity that the eardrum sits in, all right, and the lining of that epithelial tissue, and the tube that leads down from the external or the pinna portion of your ear down to your eardrum, all that is lined by, comes from, all right, the endoderm. All right. And then all the linings to the digestive system, the respiratory system, all right, reproductive and urinary tract all come from the endoderm. Okay. So I'll let you go over the rest here, all right, thyroid gland and the gallbladder and the pancreas, all right, and parts of the liver, all right, but a lot of that will come from the endoderm. So again, I don't expect you to be embryology professionals and well studied in it, but just to know just a couple of things. The book will go into a little bit more detail if you want to kind of get into that. Let's wrap up with the last part of the chapter, and we call this tissue modification. All right. So our tissues, when they engage in certain functions or when certain stresses or whatnot happen to the tissue, they can undergo certain changes. And the first time, and you may have heard of this term before, hypertrophy. All right. So like, for example, muscles. If you start to exercise quite a bit, you can undergo muscle hypertrophy. And what will happen is the size of the cells, all right, of those skeletal muscle cells will increase. Okay. Just the size. Okay. So you don't grow new cells, all right, but the size that the cells that you do have just increase. So your muscles, for example, will look bigger. All right. Now, hyperplasia is a different story. All right. Now you're going to get an increase in the number of cells for that tissue. So hypertrophy is an increase in size. Hyperplasia is an increase in number. Please don't get those two confused. All right. And then you can have tissue atrophy. We've probably heard of this. Somebody that broke their leg, or if you've been bedridden for a while, all right, you'll start to lose tissue mass depending on what we're discussing here. So tissue atrophy is when you get a decrease or a shrinkage of the cell number or the size. So we usually use the one term when we're discussing a decrease in cell number or size. Right. So as we get older, for example, after our fourth decade on the planet, every decade after that, we lose roughly about 10% of our muscle mass. So we get that skeletal muscle atrophy. Okay. That's part of the normal aging process. If you're bedridden because you were in a coma for 3 years, again, now in that situation, you'll get disuse atrophy, all right, because you weren't exercising or moving around. Okay. So there's ways to take care of that. If it's muscular atrophy, then you have to actually exercise. All right. So another type of tissue modification is known as metaplasia. All right, this is when we're dealing with, I have to point this out, the mature epithelium. All right, so what will happen is, all right, we get a change from one type of mature epithelium into another type. A lot of this has to do through adaptation, okay? Something has occurred in the internal or external environment. So the example here is smokers. All right, we'll see this all the time, all right, especially in folks that have smoked for a long period of time. So the normal epithelium, all right, in the larger respiratory structures is going to be pseudostratified ciliated columnar epithelium. So what happens over time with continued smoking, that type of epithelium then adapts and it transitions and turns into non-keratinized stratified squamous epithelium. So we go from a one layer, all right, ciliated, tall cell epithelium to a many multi-layered, flattened, all right, non-ciliated epithelium. So it's pretty crazy. But good news is, in this situation, when you stop smoking and when enough time passes, all right, that epithelium, all right, will transition back to its original form. Now you have heard that, maybe you've heard this, that after 7 years of not smoking, all right, the lungs recover. Well, there was a study done, and that's true. I think it's a little bit longer because I've read some research that says 10 years. But the 10 years is the magic number because, this is interesting, it was Dr. Colin Campbell discovered this, or I shouldn't say discovered this, but in one of the studies, in the China study that he did, that's literally what it's called, the China study. He wrote a book about it. He came up with some conclusions of his study, and he had found out that after 10 years of somebody not smoking, you quit smoking altogether, all right, not only has the epithelial tissue recovered and it's transitioned back to its original form, but the likelihood of that person getting lung cancer is the exact same as a person that's never smoked in their life. Okay, I found that just fascinating. All right, so another type of tissue modification is called dysplasia. Okay, so now what we see is our epithelial, I shouldn't say just epithelial tissue, but our tissue has actually changed into an abnormal type of tissue, often considered to be, all right, precancerous. All right, and when this is detected, then physicians, doctors want to keep that tissue under close observation. And we see that quite often when women go in for a pap smear, all right, and they scrape off the cells off of the cervix there, and they might see that there's some sort of abnormal configuration or appearance to these cells. And it's said that pretty much every female at one time, all right, at least one time, and it could be multiple times, will undergo dysplasia. So if you have an abnormal pap smear, yes, the doctor will be concerned, because that could potentially be, all right, the beginnings of, or the possibility of having cancer. But a lot of the times, it's just at that point, those cells have undergone that abnormal tissue development, but they either get sloughed off or they revert back to normal. Okay, but that's why they'll ask you, hey, come back here. We're going to do a follow-up pap smear in a month or two, and we'll see if things have gone back to normal. And I've had several patients that have had abnormal pap smears, and they go in for another pap smear, and that's fine. All right, and then this last type of tissue modification, when we're talking about tissue growth, is called neoplasia. All right, cancer. All right, but in this situation, we get out of control tissue growth. All right, it starts to just grow out of control. All right, and then we get a tumor. All right, and that tumor is made up of this abnormal tissue. And there's two possibilities of what that tumor can contain. It can contain benign growth or malignant growth. All right, benign growth is the better of the two. Obviously, it's going to be localized. It won't spread. Okay, it's the malignant growth that we get concerned about, and that's the one that gets the label of cancer, and that has the potential to spread, and we call that metastasize, or it's, you know, when it's spreading. All right, so not only does it spread, all right, but it can also invade other tissues and cause abnormal tissue growth there. Okay, and so when that occurs, all right, that could eventually lead to death depending on the type of cancer, all right, but it'll certainly lead to the interference with the normal functioning of whatever tissue it is moved to. All right. This term you need to be familiar with, necrosis, okay, that is tissue death, okay? And in a lot of cases, that is going to be irreversible. All right, gangrene is the example of that. It usually starts with inflammation, okay? So you can get that with frostbite. And if the frostbite gets bad enough, all right, you can get gangrene accumulation there, and the tissues will start to die. There's different types of gangrene. There's wet and dry gangrene, and then there's gaseous gangrene there. And a lot of it depends on the type of damage and what tissue is getting damaged. But it all starts with inflammation, okay? Inflammation occurs. All right, if it's early enough and when we stop it, then it can revert back to normal. But and the tissue doesn't die, the cells remain alive, or you might have some cells that die, but the overall tissue itself remains alive. But if it gets to the point where we have tissue death, all right, damage, then we're going to end up probably having to remove that dead tissue. All right, and then finally, you're going to see this at the end of most of the chapters from here on out. We're going to talk about what happens to the tissues or the organs and whatever systems that we go over as you age, okay? So this slide is really important. I would pretty much commit everything in here to memory, because when we go to the other chapters like bone and muscle and nerves, a lot of this applies to all of those chapters, okay? So as we get older, as we know, and again, this isn't a public service announcement or anything, but as we get older, we definitely need to maintain proper nutrition, because with that proper nutrition of the tissues, we can help sustain their lifespan, okay? And as time continues on, all right, as we get older, it becomes harder to maintain that, okay? So proper nutrition, taking care of yourself like exercising, all right, will help to promote normal circulation or proper circulation. And obviously not hurting yourself, all right, don't damage the tissue. All of that is going to promote the normal functioning. So proper nutrition, good health, normal circulation, not smoking because that damages your blood vessels, not eating garbage food where you're depositing lipids and plaque into your arteries, and trying to eat foods that aren't going to cause an inflammatory reaction. They're finding out that inflammation, certain foods can trigger systemic inflammation, not to the point where you're swollen all over your body, but it causes enough where you can cause the tissues to become inflamed, and the chronic inflammation causes degeneration. It's fact. It's fact. All right. And infrequent wounds, obviously not damaging that tissue. All of that will promote that normal functioning, okay? So as we get older, all right, the support, maintenance, the replacement of cells, and the replacement of the extracellular matrix starts to become less efficient, all right? It's just, think of it like this. Older people can't run as fast as they used to when they were 20. Well, guess what? Older cells, older tissues can't metabolize or cannot function as fast as they used to. They might still be able to function, you know, but they won't be able to do it as well. So things start to degenerate, so that our tissues nonetheless undergo that same type of degeneration over time, and especially as they get older. All right. So some of the things that we are going to see is our epithelial tissue thins. Here's an example, the epidermis. All right, that's made up of epithelial tissue. In older folks, and for those of you that work, all right, with the geriatric population, their skin becomes thinner. Part of that is because the epithelial tissue becomes thinner. Also, they start to lose some of their connective tissue underneath in the dermal layer, okay? So we'll see, all right, as you age, the connective tissue loses its ability to become flexible or resilient to certain stresses. Part of that is because our collagen production declines. Collagen is found all over the place. It helps to give strength and integrity to the dermal layer because we know that a lot of collagen fibers are located not only in large amounts in dense regular connective tissue or tendons and ligaments, but also it's in pretty considerable amounts in the dense irregular connective tissue. Collagen is a huge component. We haven't talked about this in detail yet. We've mentioned it briefly talking about bones. All right, but collagen makes up a considerable portion of the organic matrix of our bones, which is what gives our bones its kind of pliability that allows it to bend a little bit. Okay, I mentioned this before. Muscles, all right, they start to atrophy after time. Same thing with the nervous tissue. It starts to atrophy over time. Okay, and of course, as we get older, now in some cases this doesn't happen, but in most cases it does. We start to eat like crap, all right, and our circulation starts to get worse. All right, and what that will do is that will just turn up the heat on everything and increase the degeneration of these tissues. Okay, so you have a lot to look forward to as you get older. All right, no, but obviously there's ways to prevent that. Okay, and I won't say prevent it completely because you can't stop aging, but you can certainly slow down the detrimental effects of aging and what it has on tissues. All right, y'all. That concludes this video here. I hope you find it helpful. And this covers the last amount of material that you are responsible for the Lecture 1 exam. Okay? So again, you can always visit my YouTube channel for some of the review videos, or we will rewatch any of the other videos on there. I wish you the best of luck and have a great day.